Hello guys, am I audible and visible? Alright, just coming, just a moment. Hello everyone, am I audible and visible? Okay, so welcome back guys. So today we are going to talk about national health programs, everybody. All right, now this is not going to be that bigger lecture because I have included all the important NHPs, and there are certain updates also which we will also be discussing in our updates class. Okay everyone, which we will also be discussing in our updates class. So like as you can see over here guys, we are on NHPs today, tomorrow diseases, PSM formulas, and on 16th we also have PSM updates. Okay, so all the updates we are going to discuss separately. However, there are a few important points that we have to know from national health programs which we will be covering today. Alright, so can we begin? Everybody give me a thumbs up. Alright, chalo. So again, it's an MCQ based topic, and everything important that we feel can come from the exams, we will discuss that. Okay? Okay, so the first question, can you tell me what this is? Portion tracker is to track the functions of which worker? Portion tracker is to track the functions of which worker? Asha, multipurpose worker, Anganwadi worker, health assistant. क्या है इसका answer? This is something which is portion tracker. Okay, what it is? Very good. This is for Anganwadi worker. Now remember, portion tracker is an update guys, okay, which I am going to discuss on the updates class. We have now, all of you remember the nutrition program, right? Nutrition में एक program है पोषण अभियान, सबको याद है? We have discussed about पोषण अभियान also, ठीक है? So there is one program guys, पोषण अभियान. Okay, now पोषण अभियान का latest phase is 2.0. Okay, under which we have Saksham Anganwadi. Okay, Saksham Anganwadi. Alright, now this I will discuss again in the updates class. Okay, under this we have created, coming up with 3 new things. Okay, one, Poshan Vatikas. Okay, Poshan Vatikas. Poshan Vatikas means creating village gardens. Okay, school gardens और village gardens. ठीक है, gardens करना है grow, gardens में खाना उगाना है, which will provide from which vegetables and all that, which will be a source of nutrition for everybody. And under this Poshan Abhiyan 2.0 or Saksham Anganwadi, we are trying to make Anganwadi's infrastructure even more better. All right, और इसी में गाइज ये कॉन्सेप्ट आया है पोषण ट्रैकर का. आई यू अंडरस्टैंडिंग? पोषण ट्रैकर. सो दिस इज मेंट फॉर द आंगनवाड़ी वर्कर्स. ठीक है, प्लस अंडर दिस सक्षम आंगनवाड़ी वी आर ऑल्सो ट्राइंग टू spread awareness about sanitary napkins, okay, among adolescent girl. Awareness, okay, we are trying to spread awareness and access to high quality, okay, awareness and access to high quality sanitary napkins, okay, among adolescent girls. Okay, among adolescent girls. ठीक है, पहले एक स्कीम होता था मेंस्ट्रुअल हाइजीन स्कीम. ठीक है, अब इसके अंदर भी है पोषण अभियान 2.0 में भी दे हैव इंक्लूडेड दिस among adolescent girls. Okay, adolescent girls. Of course we are also talking about their safe disposal. ठीक है, we are talking about their safe disposal. Got it? Is it clear everybody? The first question, although this I will again take up on the updates class, जो कि शायद मंडे को है. ठीक है, चलो आगे बढ़ते हैं. Alright, so this was a part of Poshan Abhiyan, which is also a nutrition health program. Okay, let's move ahead. Now Anmol is what? Anmol किसके लिए? ANM online tablet based applications for the ANMs. Okay, so you can get this image, and remember nutrition में भी मैंने एक image, नहीं vaccine में मैंने एक image दिखाया था आपको. Yes, there are couple of ANMs who are holding a tab like this. Okay, so in this they are keeping a track of all the pregnant females, all the children who are due for immunization, ठीक है, track of pregnant females, okay, track of pregnant females, keeping a track of children who are due for immunization, okay, couples who are in need of family planning. So rather than, you know, putting everything on the papers, we have everything now on the tab. Clear everybody? Is it clear? Okay, so this is Anmol ANM online or a portion tracker. चलो आ जाओ. Next question. Sparsh initiative was launched to spread awareness about which of the following diseases? Anybody? ठीक है? Okay, yeah, these sessions are your confidence booster sessions, like Nidhi is writing. Okay, this is not कि मतलब कि कहीं से भी पढ़े हो guys, it's just that 1 hour you're in touch with a subject that holds a lot of importance for the upcoming FMG as well as neetpg. So no harm, no sitting with a cup of coffee and looking at the questions and recollecting everything. Okay, chalo, what is the answer to this? Yes, Sparsh initiative is for which of the following diseases? Leprosy. Sparsh initiative mein we came up with the concept of what? We came up with the concept of Sapna. Sapna is, I'll show you her image also. She is a village school girl. Okay, village school girl. ठीक है? All right. Village school girl. All right, she is a village school girl. All right, Sapna, and she is spreading awareness on leprosy. Okay, she is spreading what? She is spreading awareness on leprosy. Okay, awareness on leprosy. I'll show you how the Sapna this thing read. Okay, so I'll show you this one. Okay, so she is a village school girl who's spreading awareness on leprosy. Everybody. Okay, now let's go for now. Parrot is for, I'll give you I'll show you the image. See. First, tell me something. What is the answer to this? Okay, can you tell me this one? This following campaign in the image was launched to spread awareness about which of the following? Immunization, leprosy, child's right, TB. अब देखो, she is not Sapna. She is not Sapna. She is who? She is Meena. ठीक है? She is Meena. Alright, Meena was a concept which was launched by UNICEF, okay, promoting what everybody? Child's right, okay, Meena is child's right. See, it's an initiative protecting our rights, and you can remember it like this. It's an initiative which is protecting our rights, okay, and when our rights are protected, okay, when our rights are protected, ठीक है, all right, when our rights are protected, everybody, we feel like flying in the air. Okay, so this is Meena. Meena is child's right. Okay, UNICEF. All right, with a parrot. She is Meena. Now who is she? Who is this beautiful little sweet girl? She is Sapna. Okay, Sapna is an initiative under the Sparsh program. Okay, she is spreading awareness on leprosy. Okay, she is a village school girl who is spreading awareness on leprosy. So please don't get confused between Sapna and between Meena. Okay, don't get confused between Sapna and don't get confused between Meena. Clear? Can I go to the next question? Okay, chalo. Alright, Asbels has been initiated for which of the following disease? See, quite a number of things we will also be talking about again in the updates class. Okay, 1 or 2 things extra plus a couple of things from NHP we shall repeat in the updates class also. Alright, so Asbels was initiated for which of the, now what is this Asbels? Asbels क्या होता है? Anybody? Okay, some are writing A, C, D, मतलब makes answer. Not leishmaniasis. Asbels is again a term reserved for leprosy. Okay, it is ASHA based surveillance of leprosy patients. You understanding? Asbels. Okay, ASHA based surveillance. Alright, ASHA based surveillance for leprosy patients. Okay, it's ASHA based, it's ASHA is doing. Okay, ASHA based surveillance. And you remember that if ASHA is able to, okay, so this word, alright, Asbels. Okay, this word which is Asbels. Asbels is for leprosy, everybody. Asbels is for what? Leprosy. Sapna is for what? Leprosy. Meena is for what, everybody? Child's right. Okay? So this Asbels is for what? Leprosy. Now if you remember, Asha is supposed to receive an incentive. Okay, how much incentive? Asha को कितना incentive मिलेगा? If she is able to detect a case. without disability. Okay, if she's able to detect a case of leprosy, guys, without disability. All right, and what is the other situation? If she is able to detect a case of leprosy, okay, case of leprosy with disability. Okay, with disability. So if she is able to detect a case of leprosy without disability, she gets rupees 250. With disability, she gets rupees 200. Clear? All right. Also, if Asha follows a case of possibacillary leprosy, okay, possibacillary leprosy treatment, okay, full, she follows a case fully, treatment of possibacillary leprosy, she is going to get an incentive of 400. And if she is following up a case of multibacillary leprosy, she is receiving an incentive of 600. everybody clear? Same as you remember Janani Suraksha Yojana में भी जो initiative था. ठीक है? All right, so remember this word ashbals, remember sapna, remember sparsh. चलो, going to the next one. Let's see if you can do this. Multibacillary leprosy consists of MDT, है ना, मल्टी ड्रग ट्रीटमेंट फॉर लेप्रोसी. नाउ मल्टीबैसिलरी लेप्रोसी का रेकमेंडेड रेजिमेन क्या है? सिंपल क्वेश्चन है, बेसिक. व्हाट आर यू गोइंग टू मार्क ओवर हियर नाउ? मल्टीबैसिलरी लेप्रोसी कंसिस्ट ऑफ एमडीटी. द रेकमेंडेड रेजिमेन, ऑब्वियसली द डोजेस एंड ऑल यू कैन रिवाइज फ्रॉम योर फार्माकोलॉजी. द साइड इफेक्ट्स, द डोजेस फार्मा से कर लो एक बार, बट कम से कम हमें ड्यूरेशन PSM क्लास में कवर कर लेना चाहिए. वेरी गुड. इट इज 3 drug regimen for 12 months. Now here I want to discuss an update. Okay, here I want to discuss an update, okay, which I'll tell you later also. Possibacillary, multibacillary. Okay, now for both the types of leprosy, we are going to have 3 drug regimen now. Okay, dapsone, rifampicin, clofazimine. Okay, 3 drug for 6 months is possibacillary. You can complete it between 6 to 9 months, the treatment. Okay, 3 drug regimen, which is the 3 drugs are dapsone, okay, rifampicin, all right, and clofazimine. Okay, I'll tell you the update over here. And 3 drug regimen for multibacillary leprosy. You can complete it within 12 to 18 months. Now guys, please remember, India is going to adopt this 3 drug regimen from 1st of April 2025. Okay, from 1st of April 2025. See, there's a national strategic plan and roadmap for leprosy, which India has come up with. Okay, 2023 से 2027. I will talk about this also in the update class. Okay, India is aiming for a leprosy मुक्त भारत. ठीक है, India aim कर रहा है for a leprosy मुक्त भारत by 2027. And we already know that India में अभी लेप्रोसी ऑलरेडी एलिमिनेट हो गया था लॉन्ग बैक इन 2005. सो व्हाट इज द एलिमिनेशन क्राइटेरिया ऑफ लेप्रोसी गाइज? लेप्रोसी गॉट एलिमिनेटेड इन 2005. ओके, इंडिया से एलिमिनेट हो गया. ऑलराइट, वी हैड सेट एन एलिमिनेशन क्राइटेरिया लेस दैन 1 केस पर 10,000 population, and we are aiming for a leprosy mukt bharat by 2027. Uniform MDT of 3 drugs to be initiated from 2025 for possibacillary as well as multibacillary leprosy. Yes, very good Dr. Rohit. Current prevalence of leprosy India में कितना है? 0.45. Very good Rohit. Okay, current leprosy prevalence India में, ठीक है, current leprosy prevalence India में कितना है? So that is 0.45. Very good. Okay, all right, ठीक है. Yeah, that is there. Okay, the ones that are existing, but we want 0 new cases now. No new case should come up. Alright, let's see if you can do this. A patient is diagnosed with sputum positive TB. He took ATT for complete intensive and continuation phase. Patient found sputum negative after completion of intensive phase and continuous phase. What is the present status of the patient? Treatment complete, cured, lost to follow up, treatment failure. क्या है इसमें? नहीं अर्जुन, अभी आंसर 3 ड्रग ही है क्योंकि WHO has already launched it. Somebody ask Arjun. Yes, Arjun Batish, for for this thing leprosy, our answer is now 3 drug only. Okay, all right. So what is the answer over here? Very good, he is cured. Now what are all these terms? Why am I calling it cure? Because he has completed his treatment and at the end he is found what? Sputum negative. Whenever on completion of treatment you have a report which says your sputum negative, then only you will be called as a cured case. Okay, let me show you the this slide. Okay, what is cured? This is what this comes in your exams, outcomes of TB treatment. Okay, outcomes of TB treatment. Now see, this is cured. Cured means treatment is completed with sputum negative report at the end of the treatment. Okay, what is treatment complete? ट्रीटमेंट तो कंप्लीट हो गया है बट कोई स्प्यूटम रिपोर्ट नहीं आया है, अवेलेबल नहीं है. ठीक है, रेकरेंट टीबी स्प्यूटम पॉजिटिव एनी टाइम आफ्टर कंप्लीटिंग ट्रीटमेंट. लाइक वंस किसी ने ट्रीटमेंट कंप्लीट कर लिया, अगेन आफ्टर 2 months ही स्प्यूटम पॉजिटिव, रेकरेंट टीबी. एंड यू रिमेंबर केसेस ऑफ रेकरेंट टीबी वी रिप्रेजेंट बाय अ क्यूमुलेटिव फ्रीक्वेंसी कर्व. ओके, वी रिप्रेजेंट बाय अ क्यूमुलेटिव फ्रीक्वेंसी कर्व, जिसको क्या बोलते हैं गाइस? ओजाइव. ठीक है, okay. Laws to follow up: started on ATT and then discontinued treatment for more than 1 month. Because if you were started on TB treatment and you stopped your treatment within 1 month and again you are positive, then you will be counted as a new case only. ठीक है, रेकरेंट प्रीवियसली ट्रीटेड कॉल होने के लिए आपको ट्रीटमेंट, यू शुड हैव टेकन द ट्रीटमेंट एटलीस्ट फॉर मोर देन 1 month. ओके, डिड यू अंडरस्टैंड? सी, हु इज अ न्यू केस ऑफ टीबी? एनीवन हु इज स्प्यूटम पॉजिटिव फॉर द फर्स्ट टाइम इज अ न्यू केस ऑफ टीबी, और had started his treatment but left treatment within 1 month. अगर 1 महीने से कम में तुम ट्रीटमेंट छोड़ देते हो ना, नेक्स्ट टाइम इफ यू आर स्प्यूटम पॉजिटिव यू विल बी अ न्यू केस ओनली. टू कॉल एज अ प्रीवियसली ट्रीटेड यू शुड हैव टेकन योर ट्रीटमेंट एटलीस्ट फॉर मोर देन 1 month. ओके, रेकरेंट टीबी मतलब एक बार टीबी कंप्लीट हो गया ट्रीटमेंट, अगेन यू आर कमिंग स्प्यूटम पॉजिटिव. क्लियर एवरीबडी? Okay, what is treatment failure? Sputum is positive even at the 5th month of treatment, or any time sputum is positive after previous sputum negative report. Let's say if somebody is on treatment, okay, the sputum is coming positive even at 5th month of treatment. Okay, or once my sputum came negative, again I have like in the 3rd month it was negative, again in the 4th month it is positive. Clear? Is it clear? ठीक है, I will tell you about the diagnostic modalities. We are going to it. Don't rush. The first topic that we've discussed is outcome of TB treatment. Now you all know this is the TB logo. ठीक है, this is the Tuberculosis National TB Elimination Program. All these logos I will discuss in imageathon also. ठीक है, मतलब imageathon would be like 100 images and what they are बस. Okay, ये image है, ये image है. That would be like a rapid fire. All right. So this is National TB. Now India wants to eliminate TB by which year? India is looking to eliminate TB by 2025 and इसमें इसका aim क्या है? Zero death, zero disease, zero poverty. Nobody should be should become poor because of treatment of TB. Okay, ये गवर्नमेंट इसका इलाज कराती है. ठीक है, and what is its strategy? इसमें है test, treat, prevent. Okay, first we should test the people, okay, treat them, and then prevention takes a backhand over here. ठीक है, this is the strategy. Clear? Okay, all right. Now see, Project Akshaya, which was launched long back, but they might give you, was meant to control which disease? There's a very famous project, guys, which is known as Akshaya project. ठीक है, 2010 में आया था. It was launched to control which disease? Very good. Remember, Project Akshaya बहुत पहले का एक project है टीबी के लिए. ठीक है, ऐसे ही guys, जीत स्ट्रैटेजी किसी को पता है? जीत स्ट्रैटेजी, जीत स्ट्रैटेजी क्या था? Project Akshaya में ना, we were targeting, I had worked sometime in Project Akshaya. Okay, so I was in Project Akshaya and we were aiming to so I had 2 cities under me. I had to go visit Srinagar and I had to go visit Indore. Okay, so I was like leading a team of few people, where what is the main reason we are not being able to eliminate TB? See, it's because of private practitioners as well. Okay, so under Project Akshaya we were targeting to increase notification rates of by the प्राइवेट प्रैक्टिशनर्स. ठीक है, एक और स्ट्रैटेजी है जीत स्ट्रैटेजी. द लोगो इज लाइक दिस. ओके, इट्स लाइक अ फिस्ट, इट्स लाइक अ फिस्ट somehow. Okay, so this I will show you when I do imageathon. It is joint effort, okay, to eliminate TB. Jeet strategy, joint effort to eliminate TB. Now this Jeet strategy में we have international support also, national support. Union करके एक बहुत बड़ा organization है guys जो TB पे काम करता है. So along with them we are trying, India में भी also we were targeting to control TB. Very good, joint effort for elimination TB. Very good. और main मकसद क्या था इन सारे initiatives का? Increase notification rate. Okay, increase notification rate by the PPs, by private practitioners. And what is the incentive that the private practitioners get, guys? What is the incentive? Incentive to PP, okay, on notifying a case of TB. मान लो मेरे पास आज एक ट्रीटमेंट के लिए आता है, सो ऑन नोटिफाइंग अ केस ऑफ टीबी, इंसेंटिव टू पीपी कितना होगा ऑन नोटिफाइंग अ केस ऑफ टीबी? ₹500. ओके, एंड अगेन incentive to PP, okay, on notifying a case on treatment completion. Okay, on notifying a case on treatment completion. Okay, on TB treatment completion. ये कितना होगा everybody? फिर से कितना मिलेगा? 500. So if anybody asks you what is the total amount that was given to a PP, total amount to a PP, guys, that is ₹1,000. Okay, that is ₹1,000. Clear? Okay, chalo. Now tell me another question. Within how many days a private medical practitioner should report a case of TB to district TB officer? कितना उसको तुम timeline दोगे? Like you should do it within that timeline. 7 days, 15 days, 30 days, 20 days. What is the answer over here? Very good, 30 days. All right, and failure to notify, okay, failure to notify, all right, failure to notify a case of TB, okay, failure to notify a case of TB within 30 days, okay, is a punishable offense. Okay, is a punishable offense. All right, is a punishable offense. Clear everybody? Okay, going to the next question. Please try this out. Even if you're not able to do, I will help you. Okay, identify the correct statement with reference to National TB Elimination Program. Okay, पुराना नाम TB program का क्या था guys? RNTCP, Revised National TB Control Program. Now even if you don't remember that, it's okay. Now don't say National TB Control Program. The name is NTEP, National TB Elimination Program. ठीक है? All right. Now look at the first option. Can you all ask me your doubts towards the end, everybody? Okay, all right, we'll discuss it. देखो, अभी देखो IPCs तो है नहीं, ठीक है. Earlier it was IPCs. Yeah, somebody had written also. ठीक है, so earlier it was IPC. Yeah, now you don't have, no, so they've not made any changes to that. So we will just say it as a punishable offense. Okay, now see, pre-XDR is resistance to rifampicin or isoniazid. Follow-up sputum smear examination must be done at the end of intensive phase and at the end of treatment. Okay, patients are classified into category. We will do each statement. ठीक है, सारे statement बताओ. All right, patients are classified into category 1, category 2. ठीक है. Polydrug resistance is a TB patient who is resistant to more than first line anti-TB drug other than rifampicin and isoniazid. Now let us talk about this. Pre-XDR. It's resistant to rifampicin or isoniazid. Is it true or is it false? Option A. Pre-XDR तो has to be what? Pre-XDR is MDR प्लस एनी फ्लोरोक्विनोनोन. ठीक है, एनी फ्लोरोक्विनोनोन. ठीक है, एनी फ्लोरोक्विनोनोन एक्सेप्ट लीवो एंड मॉक्सी, एक्सेप्ट लीवो एंड मॉक्सी. ठीक है, एक्सेप्ट लीवो एंड मॉक्सी. तो ये तो गलत स्टेटमेंट है. प्री एक्सडीआर विल कम आफ्टर एमडीआर. एंड हु इज एमडीआर गाइज? एमडीआर में रेजिस्टेंस है टू बोथ रिफैम्पिसिन एंड आइसोनियाजिड, right? MDR is resistance to both rifampicin and isoniazid. Now who is pre-XDR? MDR plus any fluoroquinolone, but except levo or moxi. ठीक है, so this was again a false statement. Okay, now look at this one. Follow-up sputum smear examination must be done at the end of IP phase and at the end of treatment. See, must be done. Okay. See, we do it at fixed intervals. I will show you a line, guys. Okay. Sorry. Follow-up sputum smear आपको करना चाहिए at the end of intensive phase, and you can have two answers also over here. So when follow-up sputum smear examination must be done at the end of IP and at the end of treatment. ये तो करना ही करना है guys. IP सिर्फ IP के phase के end में नहीं करना है. This is true. Okay, follow-up should be done at the end of IP phase, also at the end of treatment. ठीक है, ये आपको करना ही चाहिए. All right. Patients are classified into category 1 or category 2. बिल्कुल गलत. No longer the categories are present. No categories now. Earlier it was there. No categories now. पहले तो category 1, 2, 3 बहुत सारे होते थे. अब क्या है, बीच में क्या हुआ, category 2 हट गया. ठीक है, category 1 ही में new and previously treated था. category 4, category 5. अब कोई category नहीं है. ठीक है. All right, we have a new case, we have a previously treated case, we have MDRs, pre-XDRs, XDRs. Okay, look at this one. Polydrug resistant is a TB patient who is resistant to more than one first line anti-TB drug other than rifampicin and isoniazid. Tell me option D. Option D भी true है. Okay, correct statements कर दो. All right, who is a polydrug resistant? Very good, Tawfiq. Who is a polydrug resistant? Polydrug resistant is a TB patient who is resistant to more than one first line anti-TB drug other than rifampicin and isoniazid. Okay, let me revise the definitions with you. Don't look at this, I will talk about this. पहले definition कर लो. ठीक है. Who is a case of drug sensitive TB? Drug sensitive TB क्या होता है everybody? Drug sensitive TB मतलब all the first line drugs are acting on it. ठीक है. Body is sensitive. ठीक है. The person is sensitive. All right. Person is sensitive to first line drugs. Okay. First line anti-TB drugs. Okay. First line anti-TB drugs. इसका treatment regimen क्या है? 2-HRZE. Okay. 2-HRZE plus 4-HRE. Alright. And what is the duration of treatment, guys? 6 months. ठीक है. 6 months. Alright. Next आ जाओ. Drug resistant. Okay. Now if I say मोनोड्रग रेजिस्टेंट, कोई मोनोड्रग रेजिस्टेंट है. मोनोड्रग रेजिस्टेंट मतलब क्या होता है, यू आर रेजिस्टेंट टू, ओके, यू आर रेजिस्टेंट टू एनी फर्स्ट लाइन ड्रग except rifampicin, because if you are resistant to rifampicin alone, okay, if you are resistant to rifampicin alone, ठीक है, rifampicin alone, आप उसको क्या बोलोगे, not monodrug, rifampicin resistant TB. Okay, what is MDR? MDR we all know, rifampicin plus INH, isoniazid. Okay, what is pre-XDR? pre-XDR होता है तुम्हारा MDR plus any fluoroquinolone. Okay, any fluoroquinolone except what? Except levo or and moxie. ठीक है. And then you have an XDR. Who is an XDR everybody? Extensive drug resistant. ठीक है. Full form क्या है? Extensive drug resistant TB. Okay, XDR क्या होता है? Extensive, not extremely, extensive drug resistant TB. Okay, extensive drug resistant TB. Now who is an XDR everybody? You are MDR plus you are any fluoroquinolone plus what everybody? Plus group A drugs. Okay, any group A drugs. Group A drugs क्या होता है? Group A drugs होता है आपका bedaquiline. ठीक है, it is bedaquiline. Okay, bedaquiline or linezolid. Okay, ऑल राइट, बेडाक्विलिन हो गया, लाइनाजोलिड हो गया, ठीक है, मॉक्सी हो गया, लीवो हो गया, मॉक्सी हो गया, लीवो हो गया. इज इट क्लियर एवरीबडी? ठीक है, ग्रुप ए ड्रग्स. ओके, सॉरी, ऑल्सो डेलामिनेट. ठीक है, डेलामिनेट, एनी ऑफ दीज. ओके, डेलामिनेट. ऑल राइट, एंड यू ऑल लर्नड व्हाट इज polydrug resistant. Polydrug resistant मतलब resistant to more than one anti-TB drug but other than rifampicin and isoniazid. ठीक है, other than rifampicin and isoniazid. Clear? So you can get a match the following type of question over here. Now see, if somebody is isoniazid monoresistant or polydrug resistant, one or more than one anti-TB drug, but this is other than rifampicin and isoniazid, other than rifampicin and isoniazid, because if you are resistant to rifampicin and isoniazid, you are any which ways MDR. इसका treatment क्या है? 6 months 0. 6 months 0 means 0 over here. What does it stand for? If I say 6 months 0, 6 months 0 का मतलब क्या होता है guys? 6 months 0 polydrug, ठीक है, polydrug resistance. 6 months 0, 0 is a mnemonic over here. Please don't say 0 कोई नंबर वंबर है, नहीं, ये न्यूमोनिक है. पायरिजीनामाइड, ओके, पायरिजीनामाइड, ओके, पायरिजीनामाइड, ऑलराइट, इथैम्ब्यूटॉल, ओके, 0 R से इथैम्ब्यूटॉल, रिफैम्पिसिन, ओके, रिफैम्पिसिन, एंड O से क्या हो गया? लीवोफ्लॉक्सासिन, ओके, O से हो गया लीवोफ्लॉक्सासिन. विल यू रिमेंबर दिस एवरीबडी? Okay, now earlier the regimen of MDR was 9 to 11 months. ठीक है, चॉब्जी एंड कोजी, यू रिमेंबर दैट न्यूमोनिक. अब उसको भूलो, क्यों? क्योंकि आज के टाइम में गाइज MDR का ड्यूरेशन ऑफ ट्रीटमेंट कितना हो गया एवरीबडी? MDR, व्हाट इज द न्यू रेजिमेन दैट वी हैव कम अप विद? WHO हैड स्टार्टेड इट इन 2022. इंडिया हैज जस्ट स्टार्टेड इट. मिनिस्ट्री ऑफ हेल्थ अभी रिकग्नाइज किया इसको. ओके, BPAL-M, MDR TB, all this is oral drug regimens, okay, and now it is how many months everybody? 6 months is the duration of treatment. क्या है BPAL-M? क्या है? So B is bedaquiline, P is pretuminid, L is linezolid, M is moxifloxacin. Okay, the previous longer 9-month BPAL regimen is this, you can let it be. Okay, this is still in this. इसको आप अभी छोड़ सकते हो, कंफ्यूज हो जाओगे. अभी सिर्फ इतना याद रखना है कि आज के टाइम में MDR TB ट्रीटमेंट का ड्यूरेशन कितना है गाइज? इट इज 6 मंथ्स. ओके, आज के टाइम में MDR TB ट्रीटमेंट का ड्यूरेशन कितना है? 6 मंथ्स. व्हाट अबाउट XDR? सो आई होप यू रिमेंबर द न्यूमोनिक BC2L2. Okay, this is how many months? 18 months. Okay, 18 to 20 months. All right, bedaquiline, ठीक है, लाइनाजोलिड, लीवोफ्लॉक्सिन, L2 हो गया, साइक्लोसिरीन, ठीक है. दिस इज BC2L2. इज इट क्लियर? व्हाट यू कैन एक्सपेक्ट इन योर FMGE एग्जाम्स और neetpg also is the definitions of all the types of TB, the outcomes, and you can expect the duration of regimen. ठीक है, कि कितना दिन MDR का ट्रीटमेंट होता है, XDR का कितना होता है. गॉट इट एवरीबडी? गिव मी अ थम्स अप इफ यू गॉट दिस क्वेश्चन. डिड यू अंडरस्टैंड दिस? ये क्वेश्चन समझ में आ गया ना सारे कोई को? बहुत सारी चीज़ें इसमें मैंने आपको बताई है. फॉलो अप कब करना चाहिए, ठीक है, कौन कौन अब कैटेगरीज नहीं होती है, ठीक है. फिर से हम लोग इसको लाइक वी गोइंग टू टॉक अबाउट in very short in the updates class as well. ठीक है, okay, let's go to the next one. Quickly tell me, a world free of TB, zero TB death, zero TB disease, zero TB is suffering is which initiative? Stop TB, DOTS 99, अक्षया, NTB. क्या है ये? वर्ल्ड फ्री. इंडिया फ्री नहीं बोल रही हूँ मैं, वर्ल्ड फ्री बोल रही हूँ. वर्ल्ड फ्री ऑफ TB, जीरो TB डेथ, जीरो TB डिजीज, जीरो TB सफरिंग. ये कौन सा इनिशिएटिव है गाइज? डॉट्स 99, नो, वर्ल्ड TB, जो ग्लोबल TB इनिशिएटिव है, जो चाहता है TB फ्री वर्ल्ड. ओके, TB फ्री वर्ल्ड. ऑलराइट, बाय 2035 गाइज, दिस इज एंड TB. NTB was launched after MGD. ओके, MDG, मिलेनियल डेवलपमेंट गोल्स के बाद आया. फ्रॉम 2015 से 2030 लाइक 2035 तक इट इज़ देयर. ओके, पहले स्टॉप TB होता था, अब क्या होता है? एंड TB. ओके, एंड दिस वाज योर हिंट, वर्ल्ड फ्री. ठीक है, सो आई शो यू द लोगो. ये NTB का लोगो है एंड यू कैन रिमेंबर दिस वन, NTB बाय 2035. ठीक है, 95%, दिस इज 95% रिडक्शन इन नंबर ऑफ TB डेथ्स, 90% reduction in incidence rate and zero poverty. Okay, 95, 90, 0. क्लियर, ये आ सकता है। वर्ल्ड फ्री ऑफ टीबी इज एनटीबी। क्लियर, 2035 तक इसको हमें अचीव करना है। गॉट इट एवरीवन? ठीक है, 90% रिडक्शन इन नंबर ऑफ टीबी डेथ्स, 90% न्यू केसेस एंड जीरो। किसी को भी ना पुअर नहीं हो जाना चाहिए बिकॉज ऑफ अ डिजीज लाइक टीबी। क्लियर? Let's see the next one. A patient on ART presents with complaints of fever and cough for 2 weeks. What is the investigation of choice? Anybody? A patient on ART. A patient on ART. Very good. ART means we are talking about people living with HIV, right? So any person who is HIV positive, we should do a CB-NAT in them to check for TB. ठीक है? Alright, this one is correct. You got it correct. Alright. And suppose you find out person living with HIV. Okay. Quickly put him on a CB-NAT. Okay. CB-NAT. अब दो situation हो सकता है. TB positive. So TB positive मतलब TB HIV co-infection. Okay. Co-infection. और इधर क्या हो सकता है? TB negative. ठीक है. TB negative. अब TB HIV co-infection में पहले क्या start करोगे? Start ATT followed by ART. Okay. Followed by ART 2 weeks later. ठीक है, 2 weeks later. 2 weeks later. People living with HIV में investigation of choice is always CB-NAT. Okay, the first investigation. जैसे people living with HIV, extra pulmonary, pediatric cases, recurrent TB cases, सब में CB-NAT is the choice. Okay. And now anyone we are suspecting of TB, at the baseline we offer CB-NAT as well. Okay, CB-NAT, chest x-ray, sputum. कोई भी बंदा जो TB सस्पेक्ट होता है, any TB सस्पेक्ट, ओके, रिमेंबर दैट इज यूनिवर्सल TB टेस्टिंग एट बेसलाइन. ओके, उसको क्या ऑफर करोगे? उस पर स्प्यूटम भी करोगे, ठीक है, स्प्यूटम AFB, उसमें CB-NAT भी करेंगे, ऑलराइट, एंड उसमें चेस्ट एक्सरे भी करेंगे. हियर द क्वेश्चन वाज इन्वेस्टिगेशन ऑफ चॉइस ऑन अ पर्सन लिविंग विद HIV. सो CB-NAT. ऑलराइट, नाउ व्हाट इज TB नेगेटिव आया, देन वी विल पुट हिम ऑन अ प्रिवेंटिव strategy. Okay, we will put the person on a preventive strategy. All right, we need to prevent TB from developing. So if he is less than 13 years, okay, we will do what? 3 months isoniazid. Okay, isoniazid, 3 months isoniazid plus रीफापेंटिन, नॉट रिफैम्पिसिन, रीफापेंटिन वीकली दोगे, ठीक है. और अगर कोई मोर देन 13 ईयर्स है तो ये अपडेट है, कितना देना है? 1 month आइसोनियाजिड, ठीक है, 1 month आइसोनियाजिड प्लस रीफापेंटिन. और ये कैसे दोगे? 1 month आइसोनियाजिड एंड रीफापेंटिन. दिस इज नाउ गिवन डेली. एंड वेन एवर यू आर पुटिंग एनी पर्सन ऑन आइसोनियाजिड, प्लीज पुट हिम ऑन पायरिडॉक्सिन एज वेल. क्लियर? इज इट क्लियर एवरीबडी? इन्वेस्टिगेशन ऑफ चॉइस in a person living with HIV is CB-NAT. ठीक है, फॉर ट्रीटमेंट ऑफ फॉर TB डायग्नोसिस. ठीक है, ठीक है एवरीवन. ओके, TB प्रिवेंटिव भी पढ़ लिया. चलो क्विकली बताओ द फॉलोइंग इमेजेस फॉर मेनी टाइम्स दैट हैज कम, दिस केम इन द लास्ट नीट PG ऑल्सो. पायरिडॉक्सिन, येस, कम से कम 10 milligram देना चाहिए. ओके, व्हाट इज द आंसर टू दिस? दिस एवरीबडी नोज. दिस इज फॉर TB, सो आई एम नॉट गोइंग टू वेस्ट टू मच ऑफ टाइम ओवर हियर. वी नो दिस. दिस इज व्हाट? निक्षय. निक्षय क्या है? वेब बेस्ड पोर्टल. ठीक है, वेब बेस्ड पोर्टल फॉर नोटिफिकेशन ऑफ TB केसेस. ऑलराइट, और इसी में अगर निकुष्ट की बात करें, निकुष्ट is web based portal for notification of leprosy. Nikush. This is what? Nishchay. This is what? Nishchay. Okay, this is what? Nishchay. So this is our Nikshay. Okay, this is our Nikshay. ठीक है, this is what? DOTS 99. DOTS 99. If you take out the tablet in the CP phase, toll free numbers are written everybody, and you have to give a call on that, which will ensure that okay, you have taken the treatment. Okay, this is a new initiative, TB मुक्त भारत. इसका लोगो देख लो, TB मुक्त भारत. Under TB मुक्त भारत everybody, we have come up with a new concept of Nikshay Mitra. Okay, we have come up with the new concept ऑफ निक्षय मित्रा, अडॉप्ट टीबी पेशेंट, ठीक है, अडॉप्ट टीबी पेशेंट, अडॉप्ट टीबी पेशेंट, मिनिमम 6 मंथ से 3 years तक, ओके. ऑल दीज कॉर्पोरेट सेटअप्स, एनी इंडिविजुअल्स जिसको भी थोड़ा चैरिटी टाइप करना है, दे हैव CSR टू शो, दे कैन डू दिस वन. क्लियर? ओके. Chemoprophylaxis of leprosy should be given to all contacts except chemoprophylaxis of leprosy. Chemoprophylaxis of leprosy should be given to all contacts. Now this is important, okay. This was an update earlier. Household contacts living with a leprosy patient for more than 6 months. Social contact, you're coming socially in contact with him of 20 hours per week for 3 months. Age more than 1 year. No. Age should be more than 2 years, okay. Age more than 2 years. So I'll just show you the this thing. Chemoprophylaxis आप household contact को दो, social contact को दो. Single dose rifampicin से children more than 2 years, not 1 year, ठीक है. Social contact क्या होता है? Contact time is more than 20 hours per week for a cumulative of 3 months. Household contact, people living in the same house. Neighborhood contact, all people living in 3 houses on either side, ठीक है. इज इट क्लियर एवरीबडी? ये कुछ क्वेश्चन आ सकते हैं क्योंकि आजकल लेप्रेसी बहुत इन है गाइज. अभी नीट पीजी में भी दैट आस्क्ड अ लॉट ऑफ क्वेश्चंस ऑन लेप्रेसी, ठीक है. Let's see if you can answer this. Which out? See, this one is something I'm expecting. Indicators for a program. Management तो pharma में भी पढ़ते हैं, ठीक है. Indicators per se is PSM part. Okay. Which out of the following is not an essential indicator for NLEP? For NLEP, essential indicator. What is NLEP? NLEP is nothing but National Leprosy Eradication Program. Please don't say elimination. National Leprosy Eradication Program, ठीक है. Prevalence rate, proportion of new cases correctly diagnosed, treatment completion rate, rate of new cases with grade 2 disabilities per 10 lakh population per year. What is your answer over here? Essential indicators. Okay, I have got a few people who are writing D. D तो बहुत important indicator है. D बहुत important indicator है guys. Let me straight away take you to the explanation. अच्छे से इसको पढ़ लो, ठीक है. This is indicators of the program. Indicators of National Leprosy Eradication Program. Most important epidemiological indicator is ANCDR. ANCDR is what? Annual new case detection rate. Okay, annual new case. I will not say number of new cases diagnosed, वो गलत चीज़ है. Annual new case detection rate. Okay, per what population? Per 1 lakh population, ठीक है. Second, most important operational indicator. What is it? Rate of new cases with grade 2 disabilities पर 10 लाख पॉपुलेशन. ये इंपॉर्टेंट है गाइज. मोस्ट इंपॉर्टेंट हेल्थ अवेयरनेस और लेप्रेसी अवेयरनेस इंडिकेटर, रेट ऑफ न्यू केसेस सेम, ग्रेड 2 डिसेबिलिटी पर 10 lakh population per year. You will also look at prevalence rate. Currently it is 0.45. You will also look at treatment completion rate as a proxy to cure rate. ऑप्शन में दे देंगे क्योर रेट, नहीं क्योर रेट नहीं है, ट्रीटमेंट कंप्लीशन रेट है, ठीक है. और ये सारे मेरे व्हाट आर दीज आर ऑल एसेंशियल इंडिकेटर्स. यू डोंट नीड टू रिमेंबर एनीथिंग एल्स. दीज आर सफिशिएंट एवरीबडी. दिस इज अ वेरी इंपॉर्टेंट स्लाइड ऑफ द डे गाइज, ठीक है. सो यहाँ पे क्या हो गया आंसर? प्रेवलेंस रेट यस. Proportion of new cases correctly diagnosed? नहीं. The word is annual new cases detection rate per 1 lakh population. That is the indicator. Treatment completion? Yes. Not cure rate. Rate of new cases with grade 2 disabilities per 10 lakh? Yes. ये सबसे important health awareness indicator भी है. Am I clear? Everybody, did you understand this? ठीक है. प्लस इसका लोगो सबको पता है. दिस आउट ऑफ ऑल द प्रोग्राम्स लेप्रेसी प्रोग्राम का लोगो बहुत आता है, ठीक है. नेशनल लेप्रेसी सिंबल ऑफ अ लोटस. ओके, नेशनल लेप्रेसी इरेडिकेशन प्रोग्राम. क्या है ये? नेशनल लेप्रेसी इरेडिकेशन प्रोग्राम, ठीक है. ओके, alright. Next one guys, quickly बताओ. Which of the following group of individuals is not to be targeted under the program represented by the symbol? Represented by the symbol. Represented by the symbol. अब ये क्या है? रेड रिबन. सो रेड रिबन मतलब नेशनल एड्स कंट्रोल प्रोग्राम, Okay, obviously migrant population is a high risk, transgender is a high risk, commercial sex workers, MSM, ठीक है, ट्रांसजेंडर्स, ऑल ऑफ देम आर हाई रिस्क. इंडस्ट्रियल वर्कर्स में NACP क्या करेगा? इंडस्ट्रियल वर्कर इज न्यूमोकोनियोसिस, ऑक्यूपेशनल डिसीजेस. ठीक है, ऑल राइट. ऑल्सो प्लीज रिमेंबर, डॉक्टर्स एंड हेल्थ प्रोफेशनल्स दे आर नॉट हाई रिस्क, दे सफर फ्रॉम एक्सीडेंटल नीडल प्रिक इंजरी. ठीक है, okay. What is the answer to this? A baby is born to a HIV positive mother. These type of questions turn up, guys. What will you do if a baby is born to a HIV positive mother? The mother claimed that she is not on ART. What should be the management of the baby? What should be the management of the baby? Anybody? Now see, the mother was claimed she is not on ART. So baby क्या है? High risk infant है. High risk infant में आपको क्या करना है? दोनों नेविरपीन एंड जीडोव्यूटीन देना है. ठीक है, अब इसका ड्यूरेशन ऑफ फीडिंग पे डिपेंड करता है. लेट मी टेक यू टू द एक्सप्लेनेशन स्ट्रेट अवे. जस्ट हैव अ लुक एट दिस. इफ एनीबडी इज अ low risk infant, low risk infant means mother on ART. Okay, mother on ART, you will put syrup nevirapine or syrup zidovudine, but which one is preferred, guys? Nevirapine is preferred. Okay, irrespective of feeding from birth to 6 weeks. If she is a high risk infant, the baby is a high risk infant, mother not on ART. ठीक है, मदर वॉज नॉट ऑन ART, तब आप क्या करोगे? सिरप नेविरपीन प्लस जीडोव्यूटिन. एक्सक्लूसिव ब्रेस्ट फीडिंग है तो बर्थ से 6 वीक्स, और रिप्लेसमेंट फीड है तो बर्थ से 6 वीक, ब्रेस्ट फीडिंग है तो बर्थ से 12 वीक्स. ओके, एंड अर्ली इन्फेंट डायग्नोसिस एट 6 वीक्स वी शुड डू विद एक तो बर्थ में करना ही करना है DNA PCR एट 6 वीक्स, और फिर एक कन्फर्मेटरी टेस्ट भी करना चाहिए एट 18 मंथ्स. ठीक है, इज इट क्लियर एवरीबडी? एंड एनी HIV पॉजिटिव प्रेग्नेंट वुमन, HIV पॉजिटिव प्रेग्नेंट फीमेल, इसको किस रेजिमेन में डालोगे? HIV पॉजिटिव प्रेग्नेंट फीमेल, व्हाट इज द रेजिमेन यू आर गोइंग टू पुट द वुमन ऑन? यू विल पुट हर ऑन TLD, tenofovir, lamivudine, dolutegravir, irrespective of gestation time. Okay, irrespective of gestational age. Okay, irrespective of gestational age. Clear? Got it, everyone? ठीक है, so here the woman claimed that she was not on ART, so we will put both nevirapine as well as zidovudine. ठीक है, also look at this. Sometimes students do get confused. High risk कौन से groups हैं for HIV? Commercial sex workers, MSM, transgenders, IV drug users. Bridge population are truck drivers, male migrant population, laborers. General population. अब कैसे आप कौन सा सर्विलेंस यूज करते हो HIV का प्रेवलेंस पता करने के लिए? एनीबडी? HIV प्रेवलेंस, व्हाट इज द सर्विलेंस टेक्निक, गाइज? डू वी हैव एक्टिव सर्विलेंस सर्चिंग फॉर केसेस और हॉस्पिटल रिपोर्टिंग? नो. फॉर HIV व्हाट डू वी हैव एवरीबडी? सेंटिनल सर्विलेंस. ओके, सेंटिनल सर्विलेंस. एंड प्लीज रिमेंबर, वी डू इट इन सर्टेन ANC clinics, antenatal clinics. Okay, it is done biennial, the frequency is biennial. Okay, once in every 2 years, and we will use whatever prevalence we get among antenatal women, that is used as a proxy indicator to find the prevalence of HIV in the community in India. ठीक है, so prevalence of HIV among antenatal females, okay, among antenatal females, okay, is used as what? Is used as proxy indicators, proxy indicator. All right, for HIV prevalence in India, for HIV prevalence national the world in India. ठीक है, for HIV prevalence in the community or nation. ठीक है, अभी कितना है? 0.22, क्योंकि हम लोग ANC ग्रुप में कर रहे हैं. क्यों? मदर टू चाइल्ड ट्रांसमिशन कॉन्ट्रीब्यूट्स 5% of total cases. Okay, of total cases, and efficiency of the route is 30%. Okay, efficiency of route is 30%. Clear everybody? chalo, just a few points I'm talking about. This you must know. Test and treat policy relates to, पहले टेस्ट करो फिर ट्रीट करो, ये है TB के लिए. ठीक है, डिटेक्ट ट्रीट प्रिवेंट, ये है TB के लिए. प्रिवेंट, टेस्ट, ट्रीट, ये किसके लिए? प्रिवेंट, टेस्ट, ट्रीट, HIV. कोई भी एडल्ट अगर HIV पॉजिटिव है, टीनो लैमी डोले. कोई भी बच्चा HIV पॉजिटिव है, चाइल्ड, ZLD. कोई भी न्यूबॉर्न unfortunately is, see, efficiency of mother to child transmission is 30%, but if the woman is on treatment, okay, pregnant female on treatment, okay, pregnant female on treatment, all right, after that guys, the risk of transmission, all right, HIV positive pregnant female on treatment, risk of transmission कितना हो जाता है, it is less than 1%, okay. और बाई चांस हम न्यूबॉर्न पॉजिटिव आ गया तो उसको किस पे, उस पर नेविरपिन नहीं पिलाओगे, ZLR, जीडो लैमी एंड रोल्टेग्राविर, ठीक है, ओके. व्हाट अबाउट एक्सीडेंटल नीडल प्रिक, क्विकली बताओ इफ समबडी सफर्स फ्रॉम अ एक्सीडेंटल, क्योंकि मैनेजमेंट ही पूछते हैं गाइस. एक्सीडेंटल नीडल प्रिक इंजरी, एक्सीडेंटल नीडल प्रिक इंजरी, ड्रग ऑफ चॉइस क्या है, नीडल प्रिक इंजरी में आपका ड्रग ऑफ चॉइस क्या है? Yes, again TLD, okay, TLD should be started within 72 hours, and it should be given till 20 years. If you start it within 2 hours, it's better. Best if started within 2 hours, all right, best if started within 2 hours, okay, best if started within 2 hours. Clear everyone? Chalo. Now I'll just take up one more vector-borne guys, then we'll do the remaining and diseases tomorrow. What is the most sensitive index of recent transmission of malaria? Anybody? Most sensitive index of recent transmission of malaria? Spleen rate, infant parasite rate, parasite density rate, slide positivity rate, ठीक है? Okay, syrup as in, what are you asking? Syrup, Ravi? Very good, not spleen rate. Infant parasite rate. Infant parasite rate is recent transmission of malaria. Spleen rate is telling us endemicity of malaria. Endemicity of malaria. Malaria endemic है या नहीं, ठीक है. Slide positivity rate आप use करते हो during outbreak. But which is one that tells us about burden of malaria? Burden of malaria के लिए API है, ओके, बर्डन ऑफ मलेरिया के लिए API है. व्हाट इज दैट? एनुअल पैरासाइट इंसिडेंस, ओके, बर्डन ऑफ मलेरिया इज API, एनुअल पैरासाइट इंसिडेंस, ओके. व्हाट इज इट? API, इट इज द total cases positive for malarial parasite out of the total population at risk, okay, out of the total population at risk, and since it is incidence we will multiply it with 1000, ठीक है. API मलेरिया प्रोग्राम कितना टारगेट कर रहा है? नेशनल वेक्टर बॉर्न डिजीज कंट्रोल प्रोग्राम, लेस दैन 1 केस पर 1000 population. That's what we are trying to achieve. API should be less than 1 case per 1000 population. Is it clear everybody? ठीक है, all right. One more thing over here. Yes, FMG exams और neetpg में भी एक और चीज़ आता है, ABER. What is that? Annual blood examination rate, okay, annual blood examination rate, annual blood examination rate. This is an indicator of what? Operational efficiency of the program, okay, this is an indicator of operational efficiency of program, how well the program is running, ठीक है, which is total slides that are positive, okay, out of the total slides examined, okay, out of the total population, ठीक है. ABER क्या होता है? total slides examined, okay, total slides that are examined out of the total population, okay, into 100, ये हमेशा परसेंटेज में आता है. So long back, you know, yeah, ABER should be more than 10%, okay. Now long back they were asking indicator of burden of malaria, API, indicator of operational efficiency of the program, okay, ABER, indicator of recent transmission of malaria, infant parasite rate. Which one indicator will you use during an outbreak? Slide positive rate, okay. चलो, okay. All right, let's have a look at this. Let us look at this guys. This is the logo, National Vector-borne Disease Control Program. This protects us from 6 diseases guys. Vector has 6 letters. वेक्टर में कितने लेटर है? वेक्टर में 6 लेटर है, ठीक है, 6 लेटर है, तो किससे प्रोटेक्ट कर रहा है? 6 डिजीजेस। आई एम श्योर एवरीबडी रिमेंबर्स, ठीक है। एक मच्छर जो आप जानते हो इज एनोफिलीज। एनोफिलीज क्या ट्रांसमिट करता है? मलेरिया। दूसरा मच्छर दैट यू नो ऑफ, द नेक्स्ट मस्कीटो दैट यू नो ऑफ इज एडीज। एडीज ट्रांसमिट्स डेंगू, ऑल राइट, चिकनगुनिया, चिकनगुनिया, ऑल राइट, चिकनगुनिया। देन यू हैव क्यूलेक्स, क्यूलेक्स इज जापानीज एनकेफेलाइटिस। फाइलेरियासिस, लिम्फेटिक फाइलेरियासिस, नेवर से ब्रूजियन या मैंसोनिया वाला, मलेयन नहीं, ठीक है। और एक है तुम्हारा सैंड फ्लाई, सैंड फ्लाई दिस इज बैंक्रॉफ्टियन फाइलेरियासिस। सैंड फ्लाई क्या कर रहा है? कालाजार, विसरल लीशमेनियासिस, Zika virus, all these are not included in NVBD-CP. Okay, all these are not included in NVBD-CP. Now look at this anti-larval, anti-adult measures. इसमें याद रखना है anti-larval measures में ECB, environmental control, which is source reduction guys. Source reduction yields the best results. ठीक है, सबसे अच्छा permanent results. कहीं drains को fill कर दो, पानी इकट्ठा मत होने दो, that is what. Chemical control, chemical control में कौन सा chemical है? Paris green. ओके, उसके बाद है तुम्हारा biological control, कैम्बूजिया fish. ठीक है, anti adult में क्या है? रेसिडुअल स्प्रे, स्पेस स्प्रेज, दैट अगेन डिपेंड्स ऑन एपीआई का वैल्यू, ठीक है। मस्कीटो मलेरिया ट्रांसमिशन सीजन जुलाई टू नवंबर। मलेरिया मंथ कब सेलिब्रेट होता है? मलेरिया मंथ सेलिब्रेट होता है जून में, ठीक है। डीडीटी, मैलेथियन, पायरीथ्रॉइड्स, ऑल दीज आर एंटी एडल्ट मेजर्स, ठीक है। एक मस्कीटो है गाइज जिसपे एंटी लार्वल, एंटी अडल्ट measures don't act. What is that one mosquito? See now, if you remember Mansonia, Mansonia was that brown color mosquito which had a very big body, very big legs, and it was sitting in a squatting position. So Mansonia is seen beneath aquatic plants. Okay, so to eliminate or to tackle Mansonia, we can't spray DDT and all that. No, removal of Pistia plants. We need to remove those plants, Pistia or aquatic plants. Clear everyone? Chalo. Alright, just a few more questions quickly. We'll have a look at this. A patient from northeastern state was diagnosed to have an infection with falciparum malaria. What is the most appropriate treatment for this patient? Now northeastern state, falciparum. What is the drug of choice? Falciparum. We all know falciparum, it is Plasmodium falciparum ACT. Okay, other states it is what? ACT SP. And in the northeast state it is ACT LM. So what is your answer over here? Artemether plus lumefantrine. Of course you have to add primer-queen. Okay, of course you have to add primer-queen. Clear? All right. And pregnancy हमने बहुत बार डिस्कस किया हुआ है. Pregnancy first trimester is always quinine. Okay, second and third trimester again is ACT. Primer-queen is contraindicated. ठीक है, primer-queen क्या है guys? Contraindicated है. Clear? ओके, वाइवैक्स के लिए क्लोरोक्वीन है, और आजकल इंडिया में ना वाइवैक्स फैल्सीपेरम 50-50%, ठीक है। लॉन्ग टर्म ट्रैवल ये है प्रोफाइल एक्सेस, ये भी पढ़ लेना है प्रोफाइल एक्सेस लॉन्ग टर्म। इफ यू आर ट्रैवलिंग फॉर मोर देन 6 weeks, मेफ्लोक्वीन। A to M distance is long, okay, but if you're going for short term, doxy. A to D, the distance is short. When it should be started and for how long it should be this thing, you should know that. And this is which level of treatment guys, and which level of prevention? Primary level, because ये profile access है, risk factor है, क्योंकि हम मलेरिया एंडेमिक जोन में जा रहे हैं, ठीक है। Alright, one more question over here. Let's have a look at 2 more MCQs. Patient reported fever for 1 week duration, also complains of abdominal distension, loss of appetite, lymphadenopathy. Patient is responding poorly to antibiotics, anti-malarial. Patient got a Vidal done but negative, RK39. RK39 किसका है? RK39 is the diagnostic of very important काला आजार, ठीक है, लीशमेनियासिस, लाइपोसोमल एम्फोटेरिसिन बी। और प्लीज रिमेंबर काला आजार सैंड फ्लाई पे इंसेक्टिसाइड ऑफ चॉइस पायरीथ्रॉइड्स है, ठीक है। ये 2 पॉइंट हमें याद रखना चाहिए, ठीक है। ओके, वन मोर थिंग ओवर हियर, दिस वन मोर क्वेश्चन वी विल टेक अप। बताओ इसका आंसर क्या है? आइडेंटिफाई द करेक्ट स्टेटमेंट रिगार्डिंग एलिमिनेशन ऑफ लिम्फेटिक फाइलेरियासिस। Okay, elimination of lymphatic filariasis. Now filariasis, you all know the vector is Culex. Okay, filariasis, Culex. Quincke fasciaticus, fatigans. So is it dual therapy for elimination of transmission? No. Now we have which therapy, guys? Triple therapy. Triple therapy means we are using DC, albendazole plus ivermectin. Okay, to eliminate filariasis as well as kala azar. The target was not 2025, it was 2020. Okay, considered eliminated when number of microfilary carriers less than 5%? No, less than 1%. Considered eliminated when children born after initiation of program are free from antigenemia? Yes. There should not be any circulating filarial worms in the body of any baby who is born after the program has been eliminated. Okay, so MD mass drug administration करना कहाँ है? ठीक है, MDA सॉरी मास ड्रग एडमिनिस्ट्रेशन. सी फर्स्ट ऑफ ऑल हर स्टेट में थोड़ी करेंगे, हर एक कम्युनिटी में. वी नीड टू फाइंड आउट द प्रेवलेंस ऑफ फाइलेरियासिस. ओके, इफ वी सी इट इज मोर देन 1%, वी इनिशिएट MDA. MDA हम लोग करते हैं फॉर 5 to 6 years. ओके, 5 to 6 years. ऑल राइट, एनुअली 5 to 6 years तक करना है एनुअली. एक बार यू हैव टू गिव देम दिस ड्रग. यू विल नॉट गिव टू प्रेग्नेंट women, you will not give to children below 2 years. Okay, then after 6 years we do TAS, transmission assessment surveys. ये 3 होते हैं, 1 2 3. Okay, which is done among 6 to 7 years old. Okay, and then we see if the prevalence has come out to be less than 1%, we stop doing MDA. You should know कितने drugs use हो रहे हैं, when it should be started, when will you for what duration it is done, when will you stop it. Are you understanding? So this is a very important question. So this was the correct answer over here. Clear? Kala azar, filariasis, ठीक है, malaria का treatment, integrated vector management. So that we have discussed. So we've touched on leprosy today, TB today, HIV/AIDS today, vector-borne diseases today. Okay, the remaining couple of things like rabies, pneumonia, NCD, that we are going to take up tomorrow in the diseases class. Is it clear, everybody? All right, this was an important session. Please do go through it. Okay, so tomorrow I'll meet for diseases. Then we are going to take up a few more couple of questions. ठीक है, ये देखो ना, न्यूमेरिकल 15 दिसंबर को है. ठीक है, ऑल राइट. हर्ष ऐसा करो ना, इंडिकेटर्स. एक एनुअल पैरासाइट इंसिडेंस है. इंसिडेंस क्या होता है? न्यू केसेस. पैरासाइट कुड बी एनीथिंग, फैल्सिपेरम, वाइवैक्स, ओवेल, व्हाटएवर. सो टोटल न्यू केसेस आउट ऑफ टोटल पॉपुलेशन एट रिस्क. ठीक है, वो है API. नाउ आउट ऑफ टोटल पॉपुलेशन हाउ मेनी स्लाइड्स यू एग्जामिन्ड? Not prepared, examined. Annual blood examination rate. Now out of those slides, examined how many positive? Slight positivity rate. Okay. Spleen rate क्या होता है? क्योंकि मलेरिया एक होलो एंडेमिक पैटर्न शो करता है. नंबर ऑफ चिल्ड्रन में मलेरिया ना एक होलो एंडेमिक पैटर्न शो करता है. होलो एंडेमिक पैटर्न, which means that it is more common among children after 2 years, and then towards adulthood it attains a constant value. Okay, so how many children 2 to 10 years of age are showing enlargement of spleen? That is endemicity. ठीक है, अभी आज कर दूंगी. ठीक है, येलो फीवर में एक ही क्वेश्चन आता है, वैक्सीन की वैलिडिटी, सर्टिफिकेट की वैलिडिटी लाइफ लॉन्ग होती है. येलो फीवर का वैक्सीन 17D है. ठीक है, एडीज उसका है, और एडीज इजिप्टाई इंडेक्स लेस देन 1% होना चाहिए. क्लियर? सिरप आप तब दोगे व्हेन द बेबी इज एट रिस्क. The mother was ART or not on ART, but if the baby comes out to be positive, then not syrup nevidamine, then you have to put the baby on ZLR. Okay, the proper treatment regimen. Clear? Okay. All right, bye bye. NEETpg PYQ, I'll try. I have the link. I will try to share that session's link. So I will see you again tomorrow.